Hyperbaric oxygen has actually a lot of research that's been done on it, and most of that research points towards the fact that hyperbaric oxygen is not effective for the treatment of persistent concussion symptoms. It's actually no better than a placebo or sham treatment. So some of the studies that have been done on hyperbaric that have showed positive outcomes are actually quite flawed in the way that they were designed. For example, they'll get a group of people with post-concussion syndrome, and the way that the study design is set up in such a way that the results are not necessarily reliable. Other ways that they do the study is if they take a whole bunch of people and they put some of them in a hyperbaric tube, and they put some of them in a tube that's not turned on, that just has what they call surface level air. They find that the results are the same thing. So most of the effect of hyperbaric is considered to be a placebo, and it's actually been ruled by the Ontario Neurotrauma Foundation in their most recent guidelines to be not a recommended treatment approach for people with concussion. Usually when they say that, it's because there isn't enough evidence yet. They'll say, oh, there's not enough evidence yet to support this particular type of intervention. In this particular case, when it comes to hyperbaric oxygen, there's actually a lot of research on it that shows that it is not effective. So I would not be looking for hyperbaric or wasting my time in trying to go that route.